Since the start of the COVID pandemic, sadly between 200 and 300 Milton Keynes residents have died. All of us have had to make changes to our way of life, and the effects of the pandemic will continue to affect our day-to-day and working lives in months to come. As we come out of the first wave of COVID, we need to look ahead and see what we can do to protect ourselves and protect and care for others in the second wave. How can we do this? What is the best way we can look after ourselves and others? It is vital that we all follow the government guidelines about washing your hands, wearing a face covering, maintaining social distance. Follow the guidance if you do become infected. As we move into autumn and winter flu season, if you are in a vulnerable group, you should have a flu jab. Lockdown has affected us all in different ways, but for most of us, it has involved anxiety about our loved ones, our jobs, and our own health. Another impact of lockdown is the effect on our diet and health. During lockdown, the sale of alcohol almost doubled, and the sales of biscuits increased by £19 million. 2 out of 3 of us say we have put on weight. Being overweight does seem to affect how well our bodies cope with the virus. How can we protect ourselves and care for others?
So COVID, or coronavirus, is a virus which is very, very closely related to the common cold. But some forms of coronavirus can cause much more serious disease. One of them is called SARS, which was a concern a couple of years ago, but then COVID-19 is a new coronavirus that's evolved over the course of the last 6 to 8 months. So a virus essentially is a very small collection of genetic material. So we as humans have something called DNA, whereas a virus has something called RNA, which is a simple collection of genetic material, and around that it's sort of encased by a protein shell. So to protect ourselves from coronavirus, it's really, really important that we reduce the chances coronavirus has to spread from one person to another person. So if coronavirus can't live in people, it can't live. It relies on us to reproduce and to carry on spreading through the community. So in order to stop it from spreading from one person to another, there are lots of things we can do. One thing, and the really important thing, is around hand hygiene, washing our hands properly and frequently. The second thing is around when we are sneezing, coughing and spluttering, to make sure we're covering our mouth either with a tissue or into our elbow. And more recently, obviously with COVID, we've started social distancing, i.e. trying to keep at least 1 metre apart, 2 metres in some circumstances, but at least 1 metre apart. And finally, face coverings or face masks. When I'm within 2 metres of people, I'm wearing one of those, as should other people be doing, in an enclosed environment.
Even though I am young, in my 20s, because my dad has a health condition, so he's in the high risk category, I've been very on top of the social distancing. But I have to say, like, when I'm with other young people my age, it's difficult, especially when you're drinking and you've kind of forgotten about the government guidelines. You're just having fun. But I think I just try and remember that, you know, there's no vaccine. We're not in normal times, so you have to do it. Yeah, you just have to do it. Yeah. It's not to control them. It's not about young people's rights. It's about health. I think a lot of people, they make it a big civil rights issue, and make it political. It doesn't need to be that way. It's just health, looking after yourself, looking after other people. If a family member or a friend, someone close to you gets COVID, then it makes you realise these numbers, it's more personal. I think it really hits home, you know. They're not just numbers, they're people's lives, loved ones.
So we've noticed during COVID that some people seem to fare worse with the virus, and we've noticed that there are particular groups of the population who, when they do get COVID, are more likely to need to come into hospital and may do less well when they come here. And specific groups include those from black and minority ethnic communities, and also people who are overweight or obese. In terms of people being overweight or obese, to be honest, people who are overweight tend to struggle more if they ever get to an intensive care unit for any reason, in that it's more difficult to move the chest and to keep air moving when there's a lot of extra weight around. So part of it is that, but also potentially the immune system may work rather differently in people with significant obesity. Now, for many of us who carry too much weight around, including myself, arguably it's a bit late now. We've got a pandemic and many of us are already overweight or obese, but there's never a bad time to start thinking about lifestyle and start thinking about reducing weight. And one of the positive things we've seen during COVID is people really having an emphasis on exercise. So doing more exercise and taking care of what one eats is really, really important. And I think the worst thing to do is to be locked up indoors, socially distant, and at the same time eating more and more junk food. I think it's really, really important to either focus on exercise, healthy eating, or both. And now's quite a good time to sort of redefine the way we live and the way we approach life with all the change that's going on. So one of the things with COVID is actually quite difficult for us to know how many people have had COVID. So we as a hospital know that we've had about 150 people die in the hospital over recent months, very sadly, from COVID. And we've had probably about 1,000 people coming to our hospital and having a positive COVID test. But we don't really know, to be completely honest, how many people in Milton Keynes and around the city have actually had COVID. Right at the beginning of all of this, tests were quite hard to come by, and it was people in hospital who were getting those tests. We're getting a better idea as time goes along though. So we've done some tests here in the hospital of our staff, and we know that 20% or 1 in 5 of our staff members have been exposed to COVID at some point over the last few months. And I'd estimate that amongst patients or amongst the population in Milton Keynes, it's probably going to be 3, 4, 5%, something of that order. So maybe 10 or 15,000 people around Milton Keynes who may or may not know it would have been exposed to COVID so far. We also don't fully understand COVID yet, so it's still a new disease. But what we do know is that some people who have COVID and come into hospital and have severe COVID still have problems to face after they go home. So specifically, there are patients who've got long periods of fatigue and feel absolutely exhausted and washed out 2 or 3 months after having COVID. And that can take an awful long time to get over. So there are other conditions called ME, and there are other conditions that are chronic fatigue syndrome, and it looks as if COVID is prone to making people potentially have fatigue for long periods of time. There's also concern about patients who are on the intensive care unit with COVID and potentially have a tube in their either in their mouth or in their throat doing their breathing for them, that those patients often need quite a long period of rehabilitation to gather their strength after being paralysed on an intensive care unit, sometimes for 3, 4, 5, 6 weeks. So diseases like COVID and also like flu are really difficult diseases because quite often young people don't necessarily suffer from them. COVID does affect young people, so young people can get COVID. Young people can also have long-term effects of COVID, including fatigue. But perhaps more importantly, when young people do get COVID, they can spread it to others. And older people in particular, as we've seen through this pandemic, can really suffer a great deal from COVID. And as we've seen in Milton Keynes and elsewhere, many patients have died as a result. So it's really, really important that young people stop the spread of COVID. We started by talking about viruses and how viruses need to get from person to stay alive. If we can stop young people hosting and looking after COVID essentially in their own bodies, then it won't have the opportunity to spread amongst other people. So a combination of vaccines and keeping people socially distant so that COVID doesn't have this opportunity to live in many, many thousands of human hosts.
People in Milton Keynes have been really good in following the national guidance about social distancing, washing hands frequently, and also wearing face coverings. However, it's really important that we still continue to follow those messages because initially we had low numbers of positive cases in Milton Keynes. However, in line with what we're seeing across the country, our numbers are increasing. What is really important is that we all need to be careful. Anyone can get it, anyone can spread it. We're seeing more cases in young people who might not become so ill, but it can then spread into communities that are more vulnerable, so older people or people with long-term conditions. So it's how we work together to make sure that Milton Keynes is a safe and healthy place. We know that we're going into winter and we will have additional challenges, and there'll be challenges for our health and social care systems. We have winter pressures. We know that we're coming into the flu season. So it's really important that people who are eligible for flu vaccinations get their vaccination as soon as possible. That's children, that is people who are under 65, who have long-term conditions like heart disease or diabetes, and it's also people who are over 65.
Young people, we need to be following this track and trace guidance. It's important. If we're contacted, we must cooperate. I mean, I feel like it's our civic duty, you know, to help other citizens, especially the ones who are more vulnerable. Yeah, and I know some people, they might not want to self-isolate for the time that they're asked to, but it's about people's health. And I know people are worried about the economy and getting back to work, but you can't build the economy back up when most of the population is unhealthy. You know, maybe getting COVID. We need to tackle this COVID first.
So what we need people who live in MK, like myself, to get involved in the COVID Community Champion Scheme, to learn more about COVID, so that when people are out and about with their family, with their friends, they can pass on good messages, good advice about COVID-19, how we can keep MK COVID safe. And the COVID Community Champion Scheme is a great way for us all to play our part. We need you.
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 We need you. We are seeking Milton Keynes residents to become COVID community champions. We will keep you updated on the latest advice and guidance so that you can protect and support your family, friends and colleagues. By having and sharing clear information, you, your friends, family and the Milton Keynes community can stay safe. If you are interested in getting involved in the COVID Community Champions Scheme, please contact us at covidchampions@milton-keynes.gov.uk. Remember, we need you.